Today I'm going to discuss the theory of nursing expertise by Patricia. This theory emphasizes the development of skills and understanding in patient care through experience and education. Rooted in Dreyfus' model of skill acquisition, this theory focuses on not how to become a nurse, but how nurses acquire and refine their knowledge and the practice over time. The progression is marked by 5 levels of nursing expertise. Let's dive in. Okay, we will start with novice. These are beginners with no experience who rely strictly on general rules to perform tasks. Their understanding is limited and inflexible. Who fits here? These are nursing students or newly graduated nurses on their first clinical experience. The key feature on this stage is strict reliance on rules and procedure and minimal situational awareness or understanding of priorities. The next here is advanced beginner. This shows acceptable performance by building on prior experience in actual nursing situations. Who fits here? Newly graduated nurses with a few months of clinical experience. The feature in this stage recognize pattern and recurring components in care situation. This also includes the require significant supervision and guidance to prioritize and make decisions. And they can manage simple tasks but struggle with complex scenarios. Next is competent. This demonstrates the efficiency and organization in care delivery with a deeper understanding in typical clinical situations. Who fits here? Nurses with 1 to 2 years of full-time clinical experience in a specific setting. The feature of this stage is prioritize tasks effectively and may be slower or less flexible in adapting to unexpected events. The next here is proficient. These are holistic understanding in patient care with ability to anticipate and adjust dynamically to evolved needs. Who fits here? Nurses with 3 to 5 years of experience in a focus area of practice. These features that they recognize important cues and patterns, and they manage complex cases efficiently. Next here is expert. They possess intuitive grasp of clinical situation without needing explicit guidelines or analysis. Who fits here? Highly experienced nurse, often in advanced roles such as clinical nurse, specialist, and nurse practitioners. The feature in this stage that they make rapid, accurate decision based on the wealth of experience, and they handle complex, dynamic situations seamlessly. Here a comprehensive example. The scenario is a 70-year-old patient admitted for a hip replacement develops sudden respiratory distress. In novice nurse, they follow protocol to check oxygen saturation but overlooks signs of worsening distress due to limited experience. In advanced beginner, they recognize labored breathing and report it to the physician but awaits for specific instructions to act. In competent nurses, they identify abnormal findings such as low SpO2, tachypnea, and administers oxygen while preparing to escalate care. In proficient nurses, they intuitively sense that the patient is developing a pulmonary embolism, prioritize the diagnostic, and informs the team proactively. And the expert nurse, they immediately connect subtle symptoms. For example, like restlessness and slight cyanosis to a life-threatening condition and coordinate life-saving interventions. These are the 7 domains of peer-identified expert staff nurses. These domains help in identifying and fostering skills necessary for high-level nursing practice. So let's start with helping role. They direct patient and emotional support to promote well-being. Next is teaching coaching function. These are educating patients and families to empower informed health decisions. Next, we have diagnostic and patient monitoring function. They assess health status and initiating interventions. Next is effective management of rapidly changing situation, responding skillfully to urgent health crisis. Next is administering, monitoring therapeutic interventions and regimens. These are implementing and evaluating treatment plans. Next is monitoring and ensuring the quality of healthcare practices, maintaining patient safety and improving healthcare standards. Next here is organizational and work role competencies. Practice within healthcare system for efficient care delivery. Let's look up for a comprehensive example in the patient's care scenario in a hospital. Let's consider the case of Sarah, a 45-year-old woman who has been admitted to the hospital with acute chest pain. The nursing team will demonstrate all 7 domains of expert nursing practice in caring for her. In the role of helping, Nurse Alex provides comfort by staying with Sarah, explaining procedures, and offering reassurance. This support teaching coaching function, Nurse Alex educates Sarah about her condition, explaining potential causes of chest pain, necessary lifestyle changes, and the importance of adhering her prescribed medication regimen. This empowers Sarah and her family to make informed health decisions. Diagnostic and patient monitoring function, Nurse Alex monitors Sarah's vital signs, performs an electrocardiogram or ECG, and observes for any changes in her condition. Identifying an abnormal ECG, Alex promptly notifies the medical team to initiate further diagnostic tests and treatment. For effective management of rapid changing situation, when Sarah's condition suddenly deteriorates, showing signs of potential heart attack, Nurse Alex skillfully manages the situation by administering emergency medication, providing oxygen, and preparing Sarah for immediate transfer for the cardiac care unit. Next, we have the administering and monitoring therapeutic interventions and regimens. Nurse Alex administers prescribed medications such as nitroglycerin and aspirin and monitors Sarah's response to these treatments. Alex ensures that the medications are given at the correct times and evaluate their effectiveness in relieving Sarah's symptoms. The monitoring and ensuring the quality of healthcare practices, Nurse Alex ensures that all procedures are performed according to best practice and safety protocols. Alex double-checks medication dosages, maintains a sterile environment for procedure, and continuously evaluates Sarah's condition to ensure high-quality care. In organizational and work role competencies, Nurse Alex coordinates with other healthcare team members, including doctors, pharmacists, and other support staff, to ensure a smooth workflow. Alex organizes patient care priorities, maintains accurate patient record, and ensures that Sarah's transition between different care units is seamless. This integrated approach highlights the essential role of nursing in patient care, overall healthcare delivery. So, this is the diagram of the theory of nursing expertise. The diagram illustrates the upside-down pyramid, where learner characteristics range from explicit to implicit understanding as nurse progress through the stage of expertise. Application guidelines move from the analytical mode to an intuitive mode, drawing on the cognitive continuum theory. This model shows how learning evolves through case studies, concept map, Socratic dialogue, and reflection, beginning at the novice stage and culminating in expert practice. To conclude, we have here the nursing metaparadigm, where person view as a self-interpreting being shaped by life, participating in shared meaning of key aspects included situation, body, personal concerns, and temporality. We have here the 5 dimensions of the body, we have here the unborn body, which is the uncultured physical form. Habitual body, socially learned behavior. Projective body, preparedness for action. The actual projected body, current situational orientation. And lastly, we have the phenomenal body, self-aware and imaginative. So, to apply this, we have the example of a nurse daily interaction with the patient. Let's consider the example of the nurse named Maria interacting with the patient John, who has been admitted to the hospital for recovery after surgery. Starting off, the unborn body, ensuring John's physical needs are met post-surgery. The habitual body, incorporating John's social habits into his care plan. Next, we have the projective body, preparing John for post-surgery activities and recovery. And the actual projective body, we have the assessing John's current condition and comfort in the hospital. And lastly, the phenomenal body, where supporting John's emotional and reflective aspect during recovery. So next, we have here the health. It is stated that can be assessed. Well-being reflects a sense of wholeness. Illness signifies dysfunction, distinct from the physical aspect of disease. Next, we have environment. The environment described as a situation, a meaningful social content shaped by personal interpretation and past, present, and future experiences. Lastly, we have nursing, defined as a caring relationship and enabling condition of connection and concern. It emphasized the moral art and ethics of care, focusing on the lived experience of health, illness, and disease. And that's all for this video, and happy learning.